Hi everyone, good day, good afternoon, good evening, good morning, whatever time you're listening to this podcast series. My name is Nnennaya Aso and I'm the host of the HSB podcast series where we talk about different, areas of healthcare. We have the health market and startup spotlight series. We have the local leadership series and the system series. Today we have the local leadership series with a phenomenal leader, somebody who, I think everyone should be able to learn from and look up to because she has, sustained this interest in healthcare for more than 20 years. And, building something for 20 years, it's tested time, it's tested and trusted. So join me today on the local leadership series. I present to you a very phenomenal leader from Nigeria. She's a very senior leader, in the healthcare space in Nigeria. I'm sure you'll be wowed by her journey. I will just pass it off to Dr. Nina to please introduce herself to the audience and tell us about who she is, and what she does. Thank you, ma.
Thank you so much for the warm introduction, isn't it? Like you said, my name is Dr. Nnennaya Kalu-Umeh. I'm a Nigerian, I'm a wife, mom, doctor, public health physician, and I've worked for a long time. I mean, like you said, 20 years is not today.
It's not beans.
Yes, it's not beans from clinics, to field work, to government at the state level, to government at the federal level. I mean, it's been a journey and, it's wonderful. And I'm happy to be here to share some of my experience with you.
Absolutely. Thank you so much, Ma. So one of the reasons that just to reiterate, we have this local leadership series is actually the gift of learning from, leaders who have gone ahead of us, right? To just learn from them what has worked in their journey, what they see and some of the challenges that still needs to be fixed, just basically learning from their journey. And I'm sure that Dr. Ninaya has quite a number of stories that she's going to tell us today on this podcast, so stay tuned. Whether future leader, whether present leader, there's always something to learn from somebody who has done this for 20 years and more. So I'm going to start off with a very, very interesting question, which is like the meat of why we are here, right? Local leadership in healthcare. I feel like leadership in healthcare is very different from other sectors. Healthcare is not like the fast consumer marketing good, advertising, finance. It's a lot different. And I'm curious to know, Ma, why did you choose to pursue a career in I know you're a doctor, but why did you choose to pursue a career in healthcare and public health?
Yeah, thank you, Ezinde. I mean, first of all, you're right. Healthcare is really complex. There's so many actors in the space, demand side, supply side, different levels, and so on, and then lives at stake. So, but why did I choose a career in health? I think it dates back to my childhood. I mean, one of the earliest stories I can remember is my mom telling me how sick I used to be as a child. On one occasion, I was throwing up, vomiting and stooling, and she just threw me on her back and ran to the nearest facility. She didn't even have any money, but she was fortunate enough, and I was fortunate enough, the doctor treated me for free. And over the years as I grew up, I saw her again and again. Something happens to a child, she just calmly picks up the child, ties him on her back, and runs to the facility to get help. And there was one other time that my dad actually dropped me off at the hospital to take care of her. I mean, she was ill and there was nobody else to stay with her. So he dropped me off and I got to see firsthand how the doctors and nurses took care of her and even play doctor. So that interest was kindled from childhood. Luckily, it aligned with parental interest at the time. Back then, it's either your parents wanted you to be a doctor or an engineer or maybe a lawyer. So it aligned very well for me.
Wow, I love the fact that you tied it back to your why, right? And how our personal experiences kind of like feeds into the interest in healthcare. Because I feel like somehow we've all had issues with our health, whether you're ill, whether you have a headache or something. Like we all had personal experiences with healthcare and having to access healthcare. And I like the way you tied your story back to your family and your mom and your dad. And also how you said you chose to just study medicine because that was one of the few career choices back then. So yeah, great why. I love that. I think you've sustained that interest for 20 years and I'm sure that has changed. How will you say that interest has changed over the time, seeing your work in the field, seeing your work with people? I know you started with your personal interest, right? But over time, do you think that interest has increased, decreased, or where will you place it?
Yeah, so I mean, it starts off with interest, and along the line, if you don't back it up with something else, you get tired along the way. So, I remember in med school, I used to be sick a lot. I had chronic sinusitis, and it was aggravated by all the chemicals in the labs and stuff. So, I used to go to the staff clinic, and there was this Dr. Chike Hebuzo I met then. And he used to talk to me about health. We just sit down and have conversations, look beyond the clinical, talk about the why. Why is somebody coming in sick? What could be the underlying reason? And he made it so interesting. And I fell in love with public health at the time, and even after that, different situations that came, I've always looked for, the whys, the reasons, how you could help people, how you could make a difference. So yes, as I evolved in my journey, I think I also evolved in purpose, focus, and, but I think the underlying thing was really, how do you help people? How do you make an impact? How do you improve and save lives?
Wow, that's actually very, very, very interesting. Shout out to Dr. Chike, wherever he is, for motivating our leader of today, and tomorrow, Dr.
Yes.
Nina. Thank you, Dr. Chike, wherever you are, for planting that seed of the interest in public health in Dr. Nnennaya. I think that what you said is actually very true, right? That over time this changes, but your passion to see that people's life are safe, that's what sustains you, and that is very, very important, because my own experience in the hospital, I never wanted to do anything else. I was like, I beg, let me go and do where I'll get money. Healthcare
Yes.
people, and
Money is
then,
important.
money is very important, very, very important. And as an Igbo girl, what do you expect? So I kind of like had that experience, and but going to the clinic for my externship, and I think that is a very good exposure for healthcare, able to go on the field, because that's where your perspective, that's where I discovered my purpose, of being on the field. That was where I discovered my purpose, that actually no, we have to do something about it, because tomorrow we might be the other one at the other side of the bed, right? And you never know, how your skill set, your grit, your resilience will actually help in saving lives. So thank you so much, Dr. Nnennaya, for sharing that story with us. Everyone, discover your why. That's the first step to becoming a local leader and a global leader in healthcare. So, Ma, I want to ask you, like, in the course of your careers, right? I'm sure that your leadership, 20 years is not today. It's decades. So, in your definition, Ma, how do you think that what are some of those challenges you faced, right? Especially, as I'm not trying to be gender biased, but I'm sure that being a leader, a woman who is a leader in healthcare, you are meant to be a nurturer. You're meant to be as a woman, you actually meant to be a nurturer, right? And the theme of this podcast is when patients meet patients, right? So how would you say this has played for you in the course of your leadership roles in healthcare?
Okay, so it's interesting you ask this, because a lot of the health workers are women, but you see, as you rise to the ranks, you see fewer and fewer women. Yeah, so it's almost like there's a broken pipeline. And some of the challenges I have faced, I think they include that work-life integration. How do you balance family issues with work? I remember as a house officer, my schedule was so busy and so tight, and I just had my first child then. I had to leave him with my mom. I don't know if you're familiar with Lagos. It's like coming from the hospital. By one day off, I'd come from the hospital, get to the junction, and wonder whether I should go and see my child, who was with my mom at the time, or go and see my husband, who was at the other end of Lagos, or just go back and lie down and rest. So there were those there were those times that were tough, but it didn't last anyway. Another challenge I had was being a female in charge of, military men in the barracks clinic. That was tough. First of all, you're a woman, and then again, there's soldiers, you're a civilian, Yes, telling them what to do, and almost as if, but then your technical skills, your leadership skills would always help you find a way to connect with them, to also bring them together and get things done. During my time in the barracks, I remember we were able to implement the rollback malaria project. Yes, find out about how people were affected by malaria and, implement some things to help them to curb that. And then also, I remember there was this case where this woman ran in with a convulsing child. She just dropped the child on top of me and ran back. And later when I asked, they said, okay, her husband was not around. Maybe she just quickly ran. She saw the child was dying and dropped him and left. So we had to stabilize that child. And when the husband came later, sat down with him, talked with him, And that was how, together with the other soldiers, we started doing that health education, engaging with the heads of the different barracks units to make sure that such things didn't happen again. And it was really great for me because I think where I really got validation was when somebody from the teaching hospital nearby, the military reference hospital, came and said, we're not seeing those cases anymore from the barracks, all those malaria fever and things, system in place, and we're dealing with that. So yeah, challenges, but
Wow.
we can surmount them.
Wow. Oh my God. Nana, you said a lot in this question that I actually want to digest a little bit. Talking about, how the females are nurturers, right? They're actually like the caretakers from, even in the nursing field, we have more females than male, right? I don't know. Maybe it's a thing that back then women were meant to pursue nursing and men were supposed to be the doctors. I don't know whether it was a thing or back then or.
Funny enough, even when I was in med school and even after graduation, some people would see me and call me a nurse. Sissy nurse, because
Are
it
you
was felt
serious?
that women should be nurses and the men should be doctors. So some
Wow.
stereotypes, yeah.
Actually, those stereotypes are real, and it's sad because we are naturals. We actually should actually even have a seat in the table talking about leadership things in healthcare because it's us taking care of the patient and we know better the pains of the patients, the challenges, and things that we can actually do. So that Nnennaya, you're a trailblazer, and I must commend you, to have risen up to your career to this point. I'm sure you have had to deal with a lot of challenges, roadblocks, resilience, even the military hospital, like being a civilian and, having to talk to soldiers, they will just, I can imagine the power dynamics, talking to a soldier, they're like, even back then, not even talking now, maybe it's easier.
Back then I was so skinny then, I was so young. So I was a bloody copper, in quotes.
My
so,
God.
so you can imagine. Yeah, but it was a good experience for me anyway. And I think there was another occasion where something similar. I had a friend who got this job, right? It was supposed to lead like a medical mission, part of a project to 9 states, and then just put the health team together, you know, set up some clinics across 9 states and, just run the whole thing. And then he didn't have the opportunity to go. So he called me in and said, please, I should handle for him. So I just jumped in. I didn't even know the
Wow.
extent of the work. And that was the
Praise the
first
Lord.
time I was organizing so many things. But I stuck with it and I did it quite well. And it opened my eyes to a lot of things. So I think another thing I learned was sometimes you just jump in and learn on the job. You mustn't know everything. I mean, leadership doesn't
Yes,
mean you
ma'am.
should be an expert in everything, but learn to work with people and learn on the job.
That's something everybody should take note. I'm also taking note of that. It's not easy to set up 9 clinics. That's actually not no small feat. Honestly,
It
wow, Dr.
isn't.
Nnennaya, thank you so much for sharing. We're so glad to have the opportunity to learn from you, and even how you navigated those challenges. And like you said, jump in. You never know. You learn on the process. You learn. From just being involved and just learning through the jobs. Nobody has it all figured out, right?
No?
We're all still learning and on the journey. So yeah, Dr. Nnennaya, this theme of this podcast is local leadership, right? And the reason why we chose the theme local leadership is because we've realized that people focus more on global health. Meanwhile, we still have issues in our local, context that needs to be addressed, right? Every context is different. And so for you, Ma, I'm curious to know what does local leadership, what has that meant in your journey? I'm sure you're not a local leader, you are a global leader in terms of like healthcare. You are all over the world. But I'm just curious to know what local leadership has meant for you, both in the high places in your career and how you build and how you show up for patients in the world.
Yeah, so thank you so much for that question. And local leadership for me, it brings to mind two things. I mean, the context and also the systems. So you have to really understand the situation around you. What's the context? What are people going through? What are the pain points? Are there barriers? Are there enablers? Are there allies you can rely on? So once you understand that, and for you to do that, it takes sometimes getting off your high horse, dropping whatever thoughts and ideas, whatever you've thought about before, and just sitting with the people and understanding what they're going through. So, because you can't design an intervention without really understanding the people. So, and no matter what degrees, I mean, best practices are wonderful, but you need to integrate that with what's on ground as well for sustainability. And then for the systems, you get to realize over time that you can't do everything yourself. There's no way you can't do everything yourself. So therefore, you must have systems, you must have people, you must have teams. You put all those together so that even in your absence, things keep running. So that's really, really important as well. So the context and the systems, critical.
Context and systems. That's what makes a local leader. It's not about certificates, not about, for lack of a better word, it's not about people get overly focused on, getting things. And it's good to have the skill set, it's good to be knowledgeable. But what I've realized in my own personal journey is that, having that opportunity to be on the have ground, like boots on the ground, right? To really understand the local challenges, the people, the way of thinking, the consumer behavior, the mindset, the care-seeking habits. There are a lot of things that differ, right? And so a best practice from a country like, say, Colombia cannot be the same thing as a country like Ghana. So that's why I feel like local leadership is so important. Like you said, context and systems. Thank you so much, Ma. I think that kind of wraps it up for us. Like, you must know the context.
Just to add one more thing, I think putting on my projects manager hat, it's good to design things on paper, but when you begin to implement, you begin to see a lot of things that will make you even go back and begin to adjust, depending on the context that you see yourself in. That's why it's important, if you don't want to do the back and forth, fully understand your context before you now begin to even implement. Make sure you carry all the stakeholders along, make sure you do your groundwork, and make sure the processes are going to work before you start.
Absolutely. I love the fact that you mentioned it's easy to have something on the paper, because I feel like we have a lot of papers, research, blog, article, different things, but no, how do you even implement it, You've actually highlighted something very important, man. I love the fact that you mentioned it, because, a lot of us focus on just doing the research, coming up with innovative ideas. But like you said, if you don't have the buy-in of the local leaders, right? People like yourself and some other local leaders, if you don't have the buy-in of, stakeholders in the space, you might not be able to implement something that would be, would stand the test of time, be sustainable over time. So thank you so much, Ma. And I'm curious to know, as a woman in leadership, right? How would you say your leadership style has evolved over time? I know that the peculiarities of being a woman itself, it's a lot, right? How you balance your, how your tone, and like, oh, women are supposed to be aggressive, women are meant to be quiet, don't talk, don't shout at me, yeah, you have to do something, you have to actually solve a problem, you have to actually touch patients' life. The theme of this podcast is when leadership means managing your patients and patients. As a leader, you have to manage your patients, and then you have to manage your own self. So I'm curious to know, Ma, how you say your leadership style has evolved from early on in your career to now that you are in the top places in leadership, Ma.
Yeah, so let me start answering that with a story. So a couple of years back, I got a job with the State Ministry of Health. And I was so excited. I was so sure I would just go straight to the public health department. I'll be traveling, seeing people and things like that. Unfortunately for me, well, I wouldn't say unfortunately. I would say fortunately, I was posted to the staff clinic somewhere at the back of the compound. Other like-minded women. So we just got together, put our heads together. What can we do to make this place more interesting? People weren't coming to the clinic. People weren't happy with us. It was so quiet. It was so dry. So at the end of the day, we decided that we would have a roster. Some people would come early, some people would come a little bit later so they will have time for their families. And then apart from that, we'd also dress beautifully and attend to the patients efficiently. And before you know it, everybody began to flock to the clinic. They are these very smart, beautiful doctors. They attend to you very well. They speak the local language. They do everything. After that, we couldn't even handle the patient load. And we got an award very soon after that. It was incredible. We were also excited. So we turned that situation around. That was an example of local leadership for me. And from there on, I spoke about the 9 states where I set up clinics and ran things, and up to when I became like a technical advisor to 2 CEOs now. So I think along the line, you learn a lot of things. You learn to be emotionally intelligent. You learn to do your own SWOT analysis, right? Do your own SWOT analysis, know your strengths, know your weaknesses, know how to leverage them, know how to bond with people, to work with your teams, know how to take advantage of situations. So many things that you can do, and over time you keep learning and relearning.
Hello, everyone. This is a local leadership series with Dr. Nnennaya Kalu, where we're talking about what local leadership means. And like I said, we focus so much on global health that we forget that the healthcare starts from the local communities and patients who are in the hospitals, even in the community level healthcare. So in this conversation, we are exploring what a leader who has done it all from ground up, from bottom to ground up, right? How she has been able to navigate her own career in public health and also leadership. So stay tuned.
Okay, so I was giving an example of a story where I worked in a clinic. Initially, I got this job in the State Ministry of Health, and I was supposed to be posted to the public health department, or so I thought, based on my qualifications. But they posted me to a clinic, and there I met some other young women like me, and we were not too excited. But we put ourselves together into a team and looked at our situation. I said, well, we can turn this around. So what we did was to draw up a roster, take turns at coming early, dress in our best, and attend to all the patients in with our happy faces or in the local languages, giving them the best of care. And before you know it, the word went round and we won an award over there. From then on, I spoke about going across 9 states, setting up clinics and managing the health team. And then all the way up, leading up to where I now serve as a deputy director, and I've now been a TA to 2 CEOs. So it's been a journey, and along the line you learn so many things. You learn to be emotionally intelligent. It's not every time that you react. Sometimes you have to you have to look at the situation and modify your behavior or response. Sometimes as well you have to also learn to work with people. You see that there are different kinds of people, temperaments, and you just have to work with all of them and get the results that you need. Again, also, you see that your results may not always speak for you. Sometimes you have to use your voice to amplify your results, advocate for yourself, because if not, nobody else will do it for you. So many lessons you learn along the way, but I think the bottom line is you keep learning and relearning.
Absolutely.
Yes, so many lessons.
20 years lesson in 30 minutes. Who beats that? We cannot learn it in 30 minutes. It's true sweat, pain, and blood that Dr. Nnennaya has learned this lesson. But definitely, Ma, we thank you for sharing your lessons with us. I think for me, I learned from what you said about just even going into the clinic and seeing nothing. Sometimes people think that leadership has to come with the lofty offices where you sit down and you're the boss. You're you have the titles in front of your name. Well, sometimes it means starting off from the bottom, right? Where you are posted to a place you don't like. How do you transform lives from a place where you have no resources? That's actually very difficult. And you've proven through this story that you've done much more than that. Just innovating, just showing up, your presence, changing how you dress. Wow, that's incredible, man. I'm so glad that you shared that with us. So everyone, you can be a leader, whether you're in the offices, whether you're in the clinic, whether you're in the ward. You all have what it takes to lead and make sure that patients' lives are safe. So thank you so much, Ma, for sharing. You already mentioned a couple of things like the emotional intelligence, and all of those things. What are those other things that we should be, as leaders, we should look out for? Like, how do we even begin to build that skill set? Do we have to wait till when we have that leadership position, or how can we begin to build ourselves as local leaders, like in terms of like preparing ourselves for that leadership position?
Yeah, thanks, isn't it? You mentioned something really important. It's not just about the title. You don't need to wait for your turn until they hand you a title and say, yes, now you're a leader. And then you begin to wonder, where do I start? No. And you start from where you are. I mean, you can lead horizontally, you can lead vertically, both up and down. It starts by, and you can transfer leadership skills from, different places. I've been a children's Sunday school teacher for about 20 years as well. And for you to teach children, you need a lot of patience.
Actually,
And I wasn't a very patient person initially, but I had to learn and transfer that. I use that as well at work. So that's one of the things. And then I mentioned learning, unlearning, and relearning. So having that learning mindset also helps you as well. Don't always think you're right and you know it all. No, you can learn from just about anybody. Another thing is working with people, getting along with people. If you're looking at results, you don't always have to like everybody, but you need to learn to work with people. That's really important.
That's hard.
And it's hard, but it's possible.
Yeah,
It's
it's possible.
possible. I mean, don't equate people's actions and reactions with the people themselves. Yes. You try to separate the two in your mind. Yes.
Yeah,
That's very
that's really
important.
very important.
Yes, yes. And another thing is if you can get a mentor, it really helps you because mentors have gone ahead of you. They have that experience. They've gone through things. When you relate with them, not just learn from them, you also get to avoid the mistakes that they may have made. Yes, so that helps you a lot. If you're lucky enough to get a sponsor, I mean, that's great. Yes, somebody who will advocate for you, push you, drop your names in rooms where you're not allowed to enter and vouch for you and say, yes, I trust this person, she can deliver. That's awesome. Jumpstart your career.
Wow.
And then sometimes you might even need a coach to help you see your blind spots and to help you walk through your issues as well. Because the truth, a lot of people are carrying a lot of baggage, maybe childhood issues, emotional issues, and they carry that to the workplace. Sometimes you need to walk through that as well. A lot of things that can really, really help you. But I think I will say that it's really time, and there's a lot of momentum around women's leadership now. It's something that we can take advantage of. In Nigeria, for instance, women make up 49.95% of the population. That's about 50%. But you see that as you advance in leadership, you have fewer and fewer women. So you wonder why there are fewer women. And the momentum is there now. How do we now begin to fix that broken pipeline to help women to get the leadership skills that they need and to enable them to lead very well? Because really, if you're going to you cannot make decisions for 50% of the population if they are not there at the seat. They don't have a seat at the table.
Absolutely.
Yes, so
Right.
we need them. We need them. Yeah.
I really love the way this conversation is going in terms of how women are nurturers and also like having a seat in the table. I think it's very, very important. You've also mentioned a couple of things that I think everybody has to walk through how to work with people. As a leader, you have to deal with people every day. Your
Yeah.
patience will be tested. Your patience will really be tested, oh.
It will.
Whether it's in the ward when you are dealing with a patient or whether it's when you are dealing with your colleague, women, we need to learn how to regulate ourselves emotionally. I think for me, that's something that, this year alone, like January, this was a very tough year for me as a leader because, I took up a leadership position in Johns Hopkins when I was still in school and it tested me. It literally, it tested me. So, but honestly, I don't think there's anything that could have prepared me for anything I'll ever do in my life than that position because I've always led, positions, right? Be it in church, be it in school, back in Nigeria, some things I do. But leading smart people is crazy. Like leading leading intelligent people, leading people from different part of the world, leading people from different race, diversity. It was a lot of lessons I had to learn, and I'm glad you mentioned this, Ma, that sometimes it's all about the results and not really about the person and how to separate the reaction to actually the output is very, very important. So thank you, Ma. I'm sure you have thousands of stories you'd have. But for that's not for everybody, it's not for the viewers.
Nah.
So, but definitely, thank you for sharing that story of resilience and also constantly improving. Like you said, seek your mentors, your sponsors, and seek people who can actually help you, be refined. And I think one thing I was speaking to a friend of mine when I started my career, I used to be very humble. Women are actually like very quiet. I don't used to talk.
Yes.
And so I didn't know that that was a weak spot as a woman. I was like, one day, one of my colleagues in the international office reported me to my manager, and my manager was like, people say you don't talk. I'm like, so that's also part of leadership, man. I'm curious, like, how do you even balance? Sometimes you also have to be humble. How do you balance that humility and also like showing up that presence as a leader, because I think women are quietly, I mean, we are all raised to be humble to some extent. We are quiet, we don't talk. But as a leader, I'm sure you have to practice your presence. So, how's that work for you? And what do you advise young people like myself who are, trying to balance that humility and also presence?
I think humility is a virtue, but
Yes.
when you say, I think women are raised to be more submissive and quiet, work in the background, do some traditional things like maybe serve tea and all that. It's socialization.
Yeah.
Yes, I remember. Okay, let me just say this. There was one meeting that we had, and I was supposed to manage that meeting or run that meeting, and then some guys come in and like, so what they're supposed to serve lunch. Who's supposed to liaise with the caterer to serve
My
lunch?
God.
I was like, yeah. So none of them was ready to do that. So I said, no problem, I'll handle it. But they were also looking at me as a female to also take the notes for that meeting. So I left the notes for them to copy and then sorted out the caterer and then came back and asked them, okay, where are the notes? Oh, we thought you were going to, you thought I was going to do both. So
Yeah.
you have those prejudices, but I would say, right, using your voice is not about humility. It's about taking your space. Yeah, you should be able, unapologetically take up space. I mean, you belong there. You belong at the table. So don't apologize for that. Take up space. I mean, you don't need to boast, but you do need to advocate for yourself and tell people what you can do. Because if you don't speak up, who else would do it? And then you'll be doing yourself a disservice. All the people who could have benefited from you, all the opportunities you would have gotten, you probably just lose that. So you must use your voice. It comes with practice. I mean, it feels strange when you're doing it because you're probably not used to it as a woman. But you just have to start. We need to do it. Yes,
Wow.
nobody else will do it.
Actually, nobody else will do it. I love that, Dr. Naya, for mentioning. I think this segment is actually very important because, and maybe one of the things that people, perhaps the other gender are not aware of is because we don't talk enough about it, right? So, for example, if we don't talk enough about this is the way you treated me, I don't like that, right? I'm a leader. I'm supposed to have done this. You are not supposed to use that stereotype. Sometimes I've come to realize that they are not even aware that they are doing this unconsciously, that because women are
Yes.
meant to be nurturers, we are meant to be
Yes.
caretakers. So when you see a female boss, you think that she's not supposed to, show up her presence. She's just supposed to be nice and sweet, and you can go away with things.
I know. You hear things like, you're our mother now. You're our big sister. You're supposed to be taking care of us now. I'd be like, okay. So who takes care of me?
So yeah, it's very, I love the fact that this came out in this conversation, and thank you, Ma, for sharing your story. And also to everyone watching, male or female, you should see that we all have different things we are battling as a woman leader. So please support us in any way you can, to help us ease our work and things we can do to push forward healthcare. So Ma, I'm sure that your career. I'm not. Maybe it has all been smooth and rosy. Have there been times where you've made mistakes? In terms of like your career. How have you bounced back? Like as a leader, how do you bounce back from making mistakes and in terms of your career?
Yeah, there will be mistakes. I mean, yeah, and I would say that it's also a process. A lot of times we don't like talking about our mistakes. We feel it makes us vulnerable, but
Actually.
but it's something that we should talk about and learn lessons from. Yes, I think one of the mistakes I've made is not knowing how to deal with people early on. I had to learn that the hard way. Yes, in trying to be assertive. Maybe I overdid it and probably antagonized some people, especially the men I work with. It's not easy being the only woman in a room,
Actually.
among men. Yes, yes. And so sometimes you try to be like the men and be more assertive and all that, but it doesn't work. So I would say be your authentic self. Yes, be your authentic self, and don't try to be like the men. Yes, use your femininity as a strength. Yes. And be objective. Don't be subjective or hyper emotional. Sometimes you need to be rational. Use the facts, use the data, and convince them. Sometimes you need to be inspirational, appeal to that side of them and inspire them to action and all that. And sometimes you just need to be a little bit assertive. Don't overdo it, but just push back a little and say, please, this is a boundary that you shouldn't cross. Yeah, so it's situational leadership. It depends on the situation.
Wow. Wow, this is a master class. I feel like maybe we need to do a women master class for because I feel like these are things you don't these are things that they sound very easy to say, but it's not so easy. It takes years of learning and unlearning and making mistakes and failing and like because you just said something very that I had to write it down. Being rational, know when to be rational and when to be emotional. Like leadership, you cannot be emotional, you have to be rational, you have to be inspirational because if you have yeah, me, I'm very emotional. Sometimes I can be emotional, sometimes like I can be I don't care, I have that. Sometimes I don't care what you say, but like you said, it's situational. You have to learn, and I think these things are easily said and done. There are things that we learn over time. Yeah.
You're right. You're right. And
Also.
yeah, as someone said, I think it was one of my mentors, Mojima Conjola. She said I should try keeping a journal. So it also helps you. You put down, okay, today this is what I did right. This is what I can learn from it, and you just go back and reflect on that. It helps you as well. Yes.
Absolutely. Absolutely. Thank you so much for sharing. Those are very, very useful tips that we can all practice. Journaling our thoughts and our emotions, kind of help us, take the load off our mind as leaders. Because I feel like we have better things to worry about than just how someone speaks in a meeting and whether someone treated us. Their patient lies on the
Yeah,
decks. And you
and we
said
hold on to that and we're so angry and upset, rewinding and rewinding.
absolutely. Absolutely. And it's not easy. Honestly, it's a lot because we are humans at the end of the day and we all have emotions. But learning to live above our emotions and regulating ourselves, that kind of helps us. And it's hard. It's really hard. And I pray that we all become stronger mentally to be able to face these challenges. So Ma, I'm gonna ask the next question. Like, how do you see, and I'm sure you as one of the top leaders in African healthcare, you are very, very I'm sure you have a very vast experience in terms of like how this the continent is shaping its leadership, right? What would you say is some of those things that African leaders are doing well, and what are those gaps that you think that African leaders can sit up to in terms of like, I don't know, like basic things that you think that we need to do better in terms of leadership for healthcare.
I think there's a lot of innovation going on in the African space. Given the recent changes in donor financing, so a lot of countries have stepped up, including Nigeria, to try and close that gap. Think about innovative ways they could fill that gap and make sure that services are not disrupted. So that's good. There are also things going on around expanding health insurance, ensuring that there is social protection. These are some of the things that you take for granted in first world countries, but well, we're trying to catch up. And like we mentioned, the context too also matters. Yes, so that's also another thing. A lot of capacity is being built as well. So there are certainly things that we're doing very well.
Yeah.
Some of the challenges I would say is that we do a lot of, like you mentioned, a lot of documents, a lot of policies. When it comes to implementation, well, I wouldn't score us so high. Sometimes when you have changes in government and leadership, you see that there's no continuity. It's almost like starting afresh again with a new set of ideas, a new set of priorities, and you lose some momentum as well. There's a lot of room for improvement, even though we're making a lot of progress as well.
Actually,
And like you said, leadership is not easy. So
it's not. Uneasy is the head that wears the crown, honestly,
it's
it
not.
is.
It's not. It
And
isn't.
definitely, I am very, very impressed with the way things are happening right now in the continent. Like, I'm so really impressed. Just 2 days ago, I saw how, talking about local leadership, how, the leaders in government, in power in African countries are taking accountability and saying, you guys, community be aware, this is what's happening, you guys be hold us accountable. I think
Yes.
those are things that are encouraging to say that okay, now leadership is now local because anybody in the community can now be a part of decision makers. I think for me, when I
Yes.
saw that, I was so impressed and I was so glad that we've gotten to this stage.
Yes, that was the first time that red letter was released, and I mean, it's open about how much the facilities, people should just walk in and demand accountability.
Yeah.
And that's how it should be, really. That's how it
That's
should
how it
be.
should be. Commending our minister and everyone who was involved in that process. That's just really, really great. So, Ma, I have a question for you. If you had a magic wand, right? What is that healthcare systemic change you would like to implement today, right? Imagine you had a wand right now to say, okay, I have the superpower to change this in healthcare. What would that be, ma?
Well, it wouldn't just be in healthcare. I think if I had a wand, I would
Mm.
change a lot of things. I mean, not just one, it's hard to pick one thing.
Yeah.
But,
Okay.
for me, if every Nigerian had access to clean potable water,
Mm.
access to a health facility less than 5 kilometers from their house, had access to health insurance, I mean, had access to information, accurate information, not misinformation about their health, I think it would solve a lot of the problems that we have already. Yes, so instead of, being curative, we just shift towards health promotion, health prevention, living healthier lives. I think it would really cut down the number of people that go to the hospital. So if I
Mhm.
were to wave that wand, it would be to make sure all those things exist in our communities and people have access to all those things so that they are more likely to live healthier lives. Yeah.
Absolutely. Wow, that's a really good one. And I think you've spoken to things that are infrastructural rather than just even the disease, because these are things that actually determine disease progression and how, even patients don't have the disease yet, how, they can be live healthier lives. So thank you for sharing this. These are some areas we don't focus on, particularly healthcare innovators. We don't really focus on these infrastructural challenges. We just leave it for the government, and we think that the government will do everything, but we need more public-private partnership to be able to solve some of these infrastructural challenges and, communication challenges that we are having in healthcare. So thank you so much for sharing that with us, Ma. Okay, so I think just to wrap up the podcast, Ma, I would like to ask you, I'm sure that, you've been doing this for 20 years, and I'm sure that, there are some days you wake up and you're like, I don't want to do this, and I don't know about you, but me, I'm speaking for myself. I don't know. Maybe you don't have those days, but and I'm like, am I the only one that will carry Nigeria problem or like the world problem? But like you said, your why keeps you on. But sometimes, what is that thing that keeps you motivated on your tough days? And yeah. And what is
Yeah,
that success principle too that has guided your success?
yeah, well, there'll be good days and there'll be tough days. I mean, it's just normal. I think what keeps me going will be number one, my faith. Yes, that's really important to me. I mean, human beings may fail you, but I mean, your trust in God and your faith keeps you going. Also, support systems are key, whether it's family, whether it's a network of like minded sisters, or people in the office. That support system is really, really important.
Mm-hmm.
I think, thirdly, for me, is the people who look up to you, those you're mentoring, directly and indirectly, people who are watching, kind of holding you accountable. You cannot afford to let them down. I'll give an example of my daughter. She's an engineering student, and sometimes she calls me, we talk and all that, and she was like, I'm now in the executive of my student union. We're having this chapter of black engineers. I'm like, okay, that's good. So we talk frankly, and a lot of people are watching you and learning from you, so you can't afford to let them down. And so those things keep me going. And but as far as principles are concerned, I mean, there are many, but I would say that passion can take you far, but discipline will take you further. So that's, you can start to be excited about something, but really, if you're not disciplined, if you're not committed, you don't keep showing up whether you feel like or not, you probably just burn out or give up and then fall by the wayside. So discipline is really, really key.
Passion can take you far, but discipline will take you farther. That's a beautiful quote to write. In fact, I'm going to by the end of these sessions, I'm going to like do a word quote of what the leaders say. I was like, maybe I'm reading it every day when I'm tired. I'm like, I beg, I cannot keep myself. Especially young people like us, you're like,
Yes,
who am I? I beg, let me
yes.
not keep myself with this
I just
world
say yourself, isn't
problem.
they get up, make your bed, jump out.
I'm telling you, ma, I'm telling you, it's not easy to, be motivated sometimes, especially when, the odds are like, what's happening? What's happening? People, it's easy to give up, especially for young people. We give up so easily, and, that's why you see young people, suicide rates, people doing a lot of things. So we need to learn from people like yourself and other leaders who have gone ahead of us. That resilience is something that we are losing touch of, and I'm glad you mentioned passion will take you far, but, discipline will take you farther. So young people, young leaders, let's learn from people like Dr. Nnennaya. Keep showing up, keep doing what you're doing. Whether you're getting the accolade, the money, the grants, just keep doing what you're doing. You never know who's watching. Thank you so much for sharing that, man.
Thank you so much.
So I just want to thank you. I think we have come to the end of today's podcast series. We have learned a lot from Dr. Naya, her story, her journey, her why, the lessons she's learned, both from the military hospital. The person, she had somebody who pushed her. She made mention of her Dr. Chike. Thank you so much, Dr. Chike. So you need to bring people along with you, carry people along, and that's what she has done. As a leader, 20 years after, she's still making reference to who brought her up, right? So thank you so much for showing us that example, Ma. And also, your result will speak for you, right? That, like you said, your result will speak, but you need to learn how to get along with people. It's very, very important that we bear in mind that as a leader, you have to work with people, and it's not about the emotions. Learning how to be rational against being emotional, learning when to be inspirational and when to be assertive. I think that is something that we don't talk enough about as leaders, and I'm so glad that Dr. Nnennaya has mentioned this in today's podcast. So, guys, this has been a very fantastic time. I'll just allow Dr. Nnennaya to give us a closing word or anything she would like to say to the next generation or anyone who is listening who is aspiring to be a leader in healthcare.
Well, first of all, I want to say thank you so much, Ezinne, for the opportunity to share some of those life
Thank you.
lessons that I've learned over the years. And to all the young people who are listening, I think first is to encourage you, really. If you found yourself in the healthcare space, I mean, it's quite a complex space, but don't give up. Be resilient, learn, explore. It's a really diverse place, and there's so many opportunities if you really open your eyes and we are open to learning. And like we mentioned earlier, keep interfacing with people, do your networking, do your learning, do your studying, because you need to be your subject matter expert as well. Yes, and don't be afraid to take risks. Try new things. Yes, try new things, and have a very solid support system, because you will need it. Some days, like Ezinne said, you won't feel like showing up, but you just have to keep going. You can't give up. People are depending on you.
Do you know that what you just said in 2 minutes now, it sounds very simple, but it's like a full 3 days master class, on how to be a leader. But thank you. This is really, I learned so much from just listening to you talk today, and I'm sure that a lot of people who listen will learn from your journey. And I must commend you. You need to get an award. We need to send you a gift basket, because you are an inspiration to every young woman who is watching this and who will watch this, because you've sustained this strength. And beyond your daughter, I am motivated by you. I see what you do. I see how you keep chasing things by even though you're at the peak of your career, you still like do things, go for fellowship, go for certificate. I'm like, who is this woman? Who is she? So definitely, ma, I'm so grateful to have had this opportunity to even learn from you and also learn from your journey. It's a gift. Some people don't give that gift of their experience, and I think that's where a lot of African leaders, I just want to please share the young generation or the middle generation. We need to learn from you. We need to do better. We need to learn the mistakes you've made, the blessings and the advice you have, because that's the only way we can get the healthcare system in our continent or wherever we are to work. So thank you for giving us this gift. We'll listen to you and make sure that we learn from your lessons, ma. Thank you to all our audience. This is the HSB podcast series, local leadership series. We have had Dr. Nnennaya share with us. We'll be having a lot more leaders in this space, who will share with us their journey. I'm sure Dr. Nnennaya will recommend some to us, but like some leaders who would, share their journey with us in terms of like how leadership has evolved for them, and what they've learned on their journey. I think having that opportunity to learn is also very important. The healthcare, like I said, is very different. You can do anything in maybe let me not say anything. You can do anything in say in a fast consumer group industry, but healthcare is like human beings' life actually at stake. So even this emotional regulation is putting your head in the right place, getting the right skill set so that people's life will be saved at the end of the day. And that's why we are having this podcast series, because you hear a lot of leadership series on different aspects, but nobody talks about the healthcare space. And thank you so much, Ma. Thank you, everyone. So look out and keep watching the HSC so much.
Thank you.